Hi, I'm Dr. Michelle with Treble Health, and I'm going to be answering one of the most commonly asked questions: does salt affect tinnitus? And whether or not I should be on a salt or sodium restrictive diet. So, to just answer the question immediately right off the bat, no. In most cases, salt does not significantly affect tinnitus. One of the reasons this has become one of the most common first recommendations for someone who has tinnitus is because of Meniere's disease. Meniere's disease is an ear disorder that is caused by fluid retention and fluid buildup in the inner ear. And one of the more common symptoms of Meniere's disease outside of hearing loss and oral fullness is tinnitus. And sodium or salt does cause fluid retention. And so for individuals who have Meniere's disease, it is recommended that they try to use diet to help control any possible fluid retention or buildup that will be in their body and may inadvertently also be inside of their inner ear. But most individuals who have tinnitus do not have Meniere's disease. And we found that not just anecdotally, but also based off of the research, that sodium restrictive diets don't seem to have a great impact on overall tinnitus perception. And in fact, trying to limit or change your diet can be another added stressor. And we know that stress greatly affects tinnitus in a negative way. So stress tends to make tinnitus worse. And if changing your diet around completely and starting to look at what you can eat or what you can't eat, or what the sodium intake is of this bag of chips versus this bag of chips, it can really start to drive you nuts. So overall, sodium and salt doesn't seem to affect tinnitus to a great degree, and I'm going to review some research studies that help to support that. So I'm going to start off by reviewing a couple of studies, but these ones focus on individuals who have been diagnosed with Meniere's disease. Again, individuals with Meniere's disease tend to have low frequency, fluctuating hearing loss, oral fullness or ear fullness or pressure, tinnitus, as well as bouts and episodes of dizziness or vertigo. So individuals with Meniere's disease are usually recommended to reduce their overall sodium, caffeine, and alcohol intake. And that is because it's believed that caffeine, salt, alcohol can all affect how much fluid pressure and buildup of fluid occurs in our inner ear. And so therefore, by reducing inner ear fluid and pressure, we can start to have improvements to our symptoms. Usually they're recommended to have a sodium intake of less than 2,000 milligrams a day. So these studies that I'm going to be reviewing looked at individuals who had Meniere's disease who had dietary changes in response to how much sodium they were actually eating on a regular basis. So one study from 2013 followed 136 individuals with Meniere's disease who actually reduced their sodium intake as well as their caffeine intake. And they were completing questionnaires to determine whether or not they felt that their symptoms had improved or were less severe over the course of a certain amount of months. So only for the individuals who followed this type of diet for more than 6 months noted a significant improvement in their symptoms. Anyone who only followed the diet for less than 6 months didn't really notice much of a change. So again, it's hard to tell whether or not it's truly due to the dietary changes or maybe something else that maybe took hold over the course of those 6 months that helped them to perceive their symptoms of hearing loss, tinnitus, ear fullness, or episodes of dizziness and vertigo as less severe or less frequent as compared to before they changed their diet. In a study that was completed a few years later in 2016, 96 individuals with Meniere's disease were looked at whether or not they noticed changes by being on a sodium restrictive diet, being on diuretics, or being on a vasodilator. And the individuals who were simply on a sodium restrictive diet did not notice any improvements or changes to their tinnitus, hearing loss, ear fullness, or dizziness symptoms. But individuals who were receiving combination treatment, they did notice more improved changes to their symptoms than that of simply being on a sodium restrictive diet, which gives the impression that just salt alone isn't enough to improve the symptoms of one's tinnitus.
This is a short break from today's video to announce the Tinnitus Guide by Treble Health. Do you want to learn about the newest tinnitus treatments and management tips? Click the link in the description of this video to get your free copy of the Tinnitus Guide by Treble Health.
There are many other studies that look at salt and sodium in individuals with Meniere's disease, and the results are kind of all over the place. There's so much variability, And the results are also quite small in terms of the population size that they actually used. So it's really hard to see whether or not there is a strong difference in terms of reducing one's salts and whether or not their symptoms of tinnitus significantly improve. But that's not to say that from an individual to individual basis, sodium restrictive diets or lower salt intake, it may really improve one's perception of tinnitus. It's just that collectively from like the research that's already been done, it doesn't seem to have a very strong relationship. And just like salt and sodium, individuals are commonly recommended to avoid caffeine or reduce their overall caffeine intake. So I'm going to review a couple of studies that also discuss whether or not caffeine has a significant impact on overall tinnitus perception. The reason why caffeine is usually recommended to be avoided or reduced is because it is a stimulant of our nervous system. So if you can not stimulate your nervous system, you may notice an improvement to your tinnitus, because we oftentimes say that tinnitus is the result of an overstimulation of our autonomic nervous system, and it can restrict our blood vessels and change our overall blood pressure. And the inner ear is very sensitive to any kind of cardiovascular changes, and it has very delicate structures that may be impacted by these types of changes to one's blood vessels or blood pressure. So that's some of the background as to why this recommendation of trying to avoid or reduce caffeine has come about. Yet, like with sodium, there isn't a really strong link between caffeine reduction and improvements to one's tinnitus. So I'm going to review a couple of studies that discuss caffeine and tinnitus. In one recent study published in 2021, the researchers had 80 individuals with chronic tinnitus, and these 80 individuals were split up into two groups. One group was receiving a caffeine capsule daily, and the other group was also receiving a capsule, but it was a placebo. It did not have any caffeine. And they were looking at whether or not individuals were noticing changes to their hearing and or tinnitus. And they actually found that there was no difference between the two groups. Both groups were perceiving an equal amount of hearing difficulty and or tinnitus, and it wasn't directly the result of whether or not they were having daily caffeine or they weren't having daily caffeine. From a study that was published in 2018, researchers looked at individuals that completed the Korean National Health and Nutrition Examination Survey to see whether or not there was a correlation between caffeine, tinnitus, and hearing loss. And they looked at thousands of individuals, and they actually found that it seemed that coffee and therefore caffeine intake was actually a protective factor in terms of hearing loss and tinnitus. And individuals who had regular intake of caffeine actually tended to have lower levels of hearing loss as well as lower levels of tinnitus as compared to individuals who had less intake of caffeine. So this study was really, again, quite different findings as compared to the previous study that I reviewed. But this is really similar to what all the research out there really states in terms of the relationship between caffeine and sodium and tinnitus. Some research studies will show that there is some kind of relationship between the two, where others completely discount any type of relationship. And again, this is what I've also seen working with patients, where some individuals will alter their diet and they may not notice any kinds of changes to their tinnitus, whereas others, they start to change some of their diet and they do notice that there's some improvements to their tinnitus. So I think that on an individual basis, there may be some improvement to tinnitus if you start to maybe reduce or minimize the amount of salt, alcohol, caffeine that you have in your diet. Even, some individuals feel that sugars and fats also affect their tinnitus levels. But it's not really necessary to completely alter one's diet because the research hasn't shown that there's a really strong evidence or link between the two. Comment below whether or not you found any kind of diet changes that have either improved or worsened your tinnitus. And if you have any other questions, again, feel free to comment below. Like this video, subscribe to our channel if you're not already subscribing to our Treble Health channel to keep up to date with all of our latest videos.
Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.